Dr. Bolanle Oyeledun, Chief Executive Officer, Center for Integrated Health Program, CIHP, an NGO, says the empowerment of young people and adolescents will enable them address their health challenges. The Chief Executive Officer said this in Abuja during the organization's 4th annual Scientific Roundtable series with the theme, The Missing Link, Reducing Vulnerability of Adolescents and Young Persons Through Sustainable Interventions.
So we've started what we call a business incubation hub, where young people are able to learn not just skills in terms of how they can improve their economic life, but also life skills in terms of how they can deal with the challenges of life. We have started what we call the STEM Hub, which is the acronym for Science, Tech, Engineering and Mathematics, to get young girls interested in science and technology, because that's where the world is. That's the future of the world. That's the future of Nigeria, and get them interested sufficiently so that they can take it on as a future course or as something that they can do to earn money. We're not just doing that, we're also looking at empowering them with life skills so they know about self-esteem, they know about public speaking, they know about dealing with other people, they know about relationships, they know about their psychology. We all have a collective responsibility to look at how to empower the young person so that he or she can actually stand very well in society. So as a country, we need to say we have an epidemic where we're not addressing the needs of our young people, where we're not looking at their intersecting vulnerabilities. If they're in school, let's keep them in school. The ones that are not in school, we have to find them and make sure they are in school. We see a lot of young people on the streets. We see a lot of adolescents, pre-adolescents who are out of school. They also become young people as they grow up with no skills, with no future in sight. So we need to collectively begin to look at harnessing those resources, channeling them in the right path, making sure we bring our policies to life, and making sure that the laws that are there are implemented to strengthen them.
Also, Dr. Chukwugozie Ujam, Deputy Director, National Agency for the Control of AIDS, said that the country has made progress in HIV and AIDS prevention and treatment.
The government of Nigeria, Federal Ministry of Health and National Agency for the Control of AIDS, with support from funders and donors alike, we are actually ahead of the curve with respect to the number of people who are living with HIV now. We are winning. What we're only striving to do right now is to make sure that we maintain the low numbers, and one of the things that we do is to ensure that there are prevention things in place and that people continue to get tested so that if they need to go on to treatment, they can at least prevent new infections. When we started the program many moons ago, we were hearing figures that were, sort of mind-blowing. But now we just have about 1.7 million people who are living with the virus, and our prevalence rate is pretty low. If you think about it's now a bit dated, but the NICE survey that was done in 2018, the prevalence is roughly 1.7 to 1.8%. When we started the program, we were hearing figures about 3 to 4%. So we are winning.
In his speech, Mr. Idowu Owohunwa, Assistant Inspector General of Police, Medical, said there was critical gaps in law enforcement. He advocated for support for effective policing and the need for systematic reforms, expressing his commitment to supporting initiatives aimed at strengthening law enforcement's ability to address significant threats.
I think the most critical gap in the process got to do with law enforcement. You may put on laws, you may put on policies, if the law enforcement component is not strong, if they do not have the capacity to understand the depth of the problems, I doubt if we can find a sustainable solution. So I want to challenge us. Doctor, you have been very fantastic in supporting us. Please extend your advocacy, your support program to the entire police family. It can start off from the position of the IG. Let the system, the leadership of the force acknowledge that this is a potent problem in this country. So that together at that strategic level, what we did in Lagos can be replicated at the national level of policing. In the process, if you need me, I promise I will support that initiative. On this note, I want to thank you for this recognition. It means a lot to me. I have been privileged to win several awards. This one is quite special to me, and it will remain so all through my career.